So I've been involved with the rare disease space for about 15 years now. I started in helping out pharma companies setting up their access programs in low to middle income countries for chronic therapies and rare diseases. And over the course of these years, I learned that while there are a lot of medicines that are being developed, there's not a lot of access that's available to the patients, that they still wait sometimes for decades to actually even get the medication into the country, even if it's available in the US. So that has then led me to trying to contribute towards an effort that improves and shortens that odyssey for the patients to get the medicine in their country. There's been so much progress in the rare disease space. Even if I just compare what was in place even just 10 years ago, if we just look at India as an example, 10 years ago there was not even a rare disease policy, there was no registry, there was no real effort that was being invested in even trying to bring medicines into the country, make them available to the patient. So we've seen in the recent years how much effort is going into all of these different areas and how much progress not only India but other countries are making towards having these medicines available to the patients and providing a lot of resources to help the patients and improve their quality of life. I wish I could summarize that for you, but there's so many different challenges. It's not just about the medicine. It's so much more that the rare disease patients struggle with. We talk about lack of diagnosing capabilities. We talk about just lack of education and awareness about rare diseases. Even just learning at the registry today and how probably a stigma is contributing just within India, that women are not even registering for the registries because culturally they probably aren't even allowed to talk about their disease. So how do you support all of these other aspects? It's much more than just the medicine. And I've come across patients who can't even afford bus fare to go to the clinic to actually go get their treatment, even if we give them treatment for free. So honestly, it's limitless in terms of all of the different things that we can't really do. This is only day one. I was at the workshop yesterday. The patient advocacy workshop was amazing to actually listen to how much work patient advocacy organizations are doing in India, how much knowledge and experience exists in the country. The session this morning where we learned about their disease registry that's happening in India, I'm genuinely blown away that much effort and work has gone into it. Learning about the manufacturing of generic medicines in India last night at the gala from Dr. Paul, that was an eye-opening conversation to hear, and I'm looking forward to what else we get to hear. It's really exciting, and I'm really happy to be here. In rare disease, that's one of the things that I feel is missing is collaboration amongst different types of entities and organizations. We're all working towards the same common goal, but we're all kind of going in our individual lanes because we have sort of like this tunnel vision of I want to get there from here to there. What I would love to see is the cross collaboration of what are some of the expertise that I can bring to the table and can you bring to the table? There's no way to solve the rare disease problem by a singular stakeholder. We all have to work together. So I think there's a huge opportunity to collaborate and work together and actually not only share our collective experience and expertise, but also probably talking about resources that are at our disposal that we can leverage from each other. There's no need to reinvent the wheel. There probably is work that you're already doing that could actually feed into what I might be doing. If we just take an example of a recent study that came out for the first time, there's actually a study on the economic burden of rare disease on the economy of a particular country. I don't have to repeat that, but I can use all of that information to then build out an argument why governments should actually look at providing access to rare disease medicines and why they should be reimbursed so you can actually reduce the economic burden. So similarly, there's a lot of efforts that are being done by patient advocacy organizations, and what Indo US Rare is doing, I think we all can just pool all of our resources and make a much bigger impact for the rare disease community and collectively in one voice.